will be our presenters today. Subject matter experts will be answering your questions along the way and at the end. Our experts are Faradine Zolchik, Environmental Health Services Manager, and our presenters.
So let's get started with a couple of housekeeping items. Please be aware to everyone in attendance, this presentation will be recorded. If you need translation at this time, please click on the ... more icon at the top of your screen and you will see translate slides. If you mouse over that, you will see 19 available languages to translate your slides into. Click the language you prefer, and after a quick processing, all your slides will be translated. Please take advantage of that if it helps. Also, if you are having difficulty with the audio for this presentation, please feel free to activate the live captions under the ... more icon at the top of the screen. We will be hosting another webinar on Thursday, December 5th, 1 to 3 p.m. We will give more details at the end. This presentation runs about 2 hours long. Again, we will take your questions along the way and at the end. To ask questions, please type them in on the chat. We will pause along the way to give you some answers and take the rest of the questions again at the end. So let's jump in. James Dragan, please take it away.
Good morning, and thank you for joining us for this webinar on the new county ordinance for children's camps. Today, we will review the requirements for children's camps, review the implementation of the county ordinance, and cover the permit application and approval process and the requirements for camps. As our moderator mentioned, please type your questions in the chat. We'll take a couple of breaks to answer a few questions and open to additional questions at the end. Please note that this presentation is specifically for children's camps that are not currently covered under state health and safety code requirements for organized camps. If you are an organized camp, you should already be under permit with Los Angeles County. Although this presentation is not specifically for organized camps, you are welcome to listen in to the presentation to get more information about this ordinance. Additionally, this ordinance applies to camps that are located in unincorporated areas of Los Angeles County at this time. As incorporated cities may adopt this ordinance, we will provide updates through our website. As a background to this ordinance, in 2019, 6-year-old Roxy Forbes tragically drowned in a swimming pool at a children's camp in Los Angeles County. Her parents established the Meow Meow Foundation to advocate for drowning prevention and children's camp safety regulations. This ordinance has been named in honor of Roxy's mother, Elena Matyas, and this ordinance closes regulatory gaps and put into place basic health and safety operating requirements for children's camps. So the purpose of the ordinance was to close these regulatory gaps for children's camps by establishing a permitting and registration system for camps here in Los Angeles County, as defined in the ordinance, and to establish minimum requirements for the health and safety of campers. So I'll start by going through a few definitions in our county ordinance to familiarize everybody with these terms, which will be used through the remainder of this presentation and are also used on our plan templates, which will be discussed during this webinar. So we'll start with the basic definition of a children's camp. It's a site and facilities attended by 5 or more children, ages 3 to 17, which is established for the primary purpose of providing a group experience with social, spiritual, educational, or recreational objectives. And it operates over 3 hours per day for at least 5 days during any 12-month period. So as we continue with those definitions, children's camps are broken down into 2 different categories. The children's day camp is a camp that has no more than 1 overnight stay per season. And there's a definition for season is equal to 90-day period. That definition is later in this presentation. A children's overnight camp is a children's camp that with 2 to 3 overnight stays per season. And again, that's a consecutive 90-day period. Organized camp is a site with program facilities established for the primary purposes of providing an outdoor group living experience with social, spiritual, educational, or recreational objectives for 5 or more days during one or more seasons of the year. And this is a definition from the State Health and Safety Code for organized camps. And this is a definition outside of the county ordinance. The ordinance definition includes an explanation of what types of businesses and facilities are not considered children's camps and that do not need to comply with camp permitting and operating requirements. These would be programs and facilities subject to licensure by California Department of Social Services, juvenile detention facilities, programs and facilities as drop-in without sign-up or registration, outdoor education programs and classes offered to students by school districts, county boards of education, private schools that are operated by California Education Code requirements. And organized camps, which we have mentioned, are already covered under state law and regulation. So I'll continue with the definitions. A camper is defined as any person aged 3 to 17 who is participant in a children's camp. The camp operator is the entity that owns, leases, rents, or operates a children's camp or organization that has care, charge, or control of a children's camp. Counselor is a staff member who supervises and operates activities involving campers at the camp. This person must be at least 16 years old and at least 2 years older than any campers that they are supervising. A director is the individual that has primary responsibility for camp operations. This person must be at least 25 years old and have 2 seasons of administrative or supervisory experience in camp activities. Passive activities. Passive activities are where campers are engaged in low-risk activities with limited chance of injury. Activities may include, but are not limited to, storytelling, coloring, viewing movies or drama, singing, playing board games, computer use, and classroom instruction. As we mentioned earlier, season is a consecutive 90-day period as defined in our ordinance. A specialized recreational activity is an activity that may expose a camper to risk of serious injury due to inherent danger of that activity. Such specialized recreational activities could include, but are not limited to, zip lining, diving, boating, horseback riding, rock climbing, shooting sports, high rope courses, operating ATVs, canoeing, aquatic activities. Specialized recreational activities do not include, I just want to make a note that they do not include sports played on courts or fields. So we'll talk a little bit about the implementation. The provisions related to the application and procurement of the camp's registration and permit are effective January 1st, 2023. The enforcement for failure to comply with these provisions related to the children's camp and registration permits begins March 1st, 2023. That we wanted to give a time period in between that allow camps to get their applications to us for review and get that process going. After March 2023, failure to get the permits needed could result in a camp closure or administrative citation. I do want to note our goal is not to close camps and not to issue citations. Our goal is to get everybody properly permitted and on their way. So we will certainly be ready to help all camps who need assistance. So how do you know if you need to obtain a permit or register with public health? All children's camps operating for 4 weeks or less in any 12-month period are required to register with the department before beginning camp operations and comply with all ordinance requirements. All children's camps operating for more than 4 weeks in a 12-month period are required to obtain a public health permit before beginning camp operations. All camps that offer 4 or more overnight stays must obtain a public health permit and comply with the state requirements for organized camps. So under the camp ordinance, we have the first category, you would register with environmental health, public health, and the other camp, you would get a permit. So that we'll explain the differences between those two. So this is kind of a chart, and this will be available on this PowerPoint for your view later. And it's a flow chart where you ask yourself questions and you can find out how you would, are you required to have a permit, and if so, what kind? So if you start in the left-hand corner there, up in the right left-hand corner, you ask yourself the first question: does your camp have 4 or more overnight stays? If your answer is yes, then you go directly down and you're required to have a public health permit as an organized camp, and that's under state requirements. If your answer is no, you go to the second question: does your camp operate in LA County unincorporated area? If your answer is no, you move to the right and your camp does not require a public health permit at this time. If your answer is yes, your camp is located in a county unincorporated area, you go to the next question: does your camp operate over 3 hours or more for at least 5 days in a 12-month period? If your answer is no, then again, at this time, your camp is not required to have a permit. If your answer to that question is yes, you move down and ask the next question: does your camp operate more than 4 weeks in any 12-month period? If your answer is no, then you would be required to register with us as a children's camp. And registration means that you have to comply with all the regulations, and you would submit your application and information. Once we approve your camp, we would register your camp. Registered camps are not going to receive an annual inspection. However, we would respond to complaints on the camp. So if your answer to that question was yes, then you move down and ask yourself the next question: does your camp provide 2 or 3 overnight stays per season or have specialized recreational activities? If your answer is no, you would be categorized as a children's day camp, which requires application and permit, public health permit. And the fees are noted there below in the triangles. If your answer is yes, then you would be categorized as a children's overnight camp or a children's camp with specialized activities. So it's kind of a flow chart that helps you decide where you fit in the county ordinance as far as what your camp, how your camp operates within the county unincorporated areas. The plan review and registration and permit fees have been established and are included in the county ordinance. Public health will conduct plan review of all camps registering or applying for a permit. Once approved, camps are required to register annually or maintain an annual permit, depending on your camp category. Permitted camps will be routinely inspected each year, while registered camps will be inspected on a complaint basis. When we do receive a complaint on regarding a camp that's registered with us, the camp would be charged a fee if the complaint is justified when we go out. Otherwise, they would not. And also to please be aware that any camp that has a pool, a public pool, or food facilities that requires a separate permit through public health. So the application process. So let's talk a little bit about that. Effective January 1st, 2023, as mentioned earlier, an application must be filed to obtain a public health permit or registration, and we need to receive this 60 days prior to the operation of the camp. That would include a completed application with proof of ownership, complete plans for proposed camp. It would include a plot plan showing the restrooms, water supply, cabin locations, pools, etc. The written operating procedures and plans, the notice of intent to operate, On-site food facilities and pools must be separately permitted by the department. Also, living quarters must have approvals from building and safety and the fire department. So these forms we're going to go through in detail through this webinar, and the information and forms will be available on our website also. For after this meeting, you can follow up with that. As mentioned at the start of the presentation, this ordinance currently only applies to children's camps in the unincorporated areas of Los Angeles County. To check to see if your facility is in an unincorporated area, please use the link on the slide. And you can see that second link there. If you click on that link through our Public Works department, you can type in your address and it will show you whether your address is within an incorporated area or not. If your business is located in the unincorporated area, you can submit your application through the Camps and Schools program email. That's the first link there on the slide here. Once submitted, you will receive payment and further instructions on how to move forward. So upon completion of your initial application review, a site evaluation will be conducted by Public Health 30 days prior to opening of your camp. If all requirements are met, a public health permit or a registration will be issued to the camp operator. So at this point, I'd like to take a short break to review any questions that have come through the chat.
At this moment, we have a question in the chat on the screen from Andy Williams. He states, I understand that only unincorporated areas of LA County are currently required to follow this ordinance. However, I believe there are 7 to 9 cities that auto-adopt all new ordinances from LA County. Are they required to follow this even if they are unincorporated? Tavik, would you like to address this question?
Now, we would still need to clarify with the auto-adopt cities to see if they're going to come on board with the ordinance. But currently, unincorporated areas all have to be submit the applications. We'll follow up with the auto-adopt cities later with our Q&A. Jim, you wanted to add anything?
Yes, at this time, it's only the county unincorporated areas. As noted, there are several cities that have auto-adopt language. However, for this ordinance, we're going to be starting with unincorporated areas only, and those auto-adopt cities would need to adopt this ordinance at this time.
Yeah, and this is for, and also, yeah, in the future, we're expecting we're going to reach to the cities or they're going to reach to us, but it's in the future. Right now, like Jim said, it's unincorporated only.
Okay, we have another question in the chat. Car asks, how is it working with the permit year starting on July 1? Will we need to file for a new permit in the middle of our camp summer? Tadevik?
No, once we go to our permitting process, it will auto renew. So every July 1st, you will receive invoice to pay for the permit, and as long as like you keep operating, you'll auto renew your permit, and unless you tell us that you discontinued the operation or there's an ownership change.
Okay, just allow a couple more seconds, see if there are any more additional questions. Okay, Tadevik, if you want to continue with the presentation.
Sure. Hello, everyone. My name is Tadevik Sahakian. As mentioned earlier, I'm the Chief Environmental Health Specialist for the Camps and Schools program. So I'll go over a little bit. I'll take over from inspection frequencies. Jim already addressed it slightly regarding the inspection frequencies. Like he mentioned earlier, The camps that are registered, the inspections will be conducted only on complaint basis. And the camps that will obtain a public health permit will have one unannounced routine inspection during the camp operation for the campsite, and 2 inspections of the pools if there are any pools located on the campsite. And as also Jim mentioned, the pools have separate permit issued to them. And also the food operations that also have to be separately permitted at the camp if the food is served. Depending on what kind of an operation, it's 1 to 3 inspections, depending on the risk category of the food facility that's on the camp. And again, the complaint investigations, if we receive any complaints from public, it will be conducted in both with the public health permit side and also the registration. And like it was mentioned before, all justified complaints will have an additional fee to be charged. Going forward, the written description of operating procedures must be submitted to the department and have to describe the following. Excuse me. Supervisor qualifications and training. That is satisfactory evidence must be provided that all staff is trained in the principles of first aid and CPR, mandatory reported trainings. The written statements have to be provided for the background checks in the following slide. We'll be going over the background checks a little more. The staff skill verification criteria and process have to be mentioned, and the camp should have site-specific skill requirements listed and described how the skills are verified for the staff. The camper eligibility requirements, if the camp has any eligibility requirements for the campers, it has to be noted on the procedures, what requirements are there and how the requirements are verified. The counselor to camper supervisor ratios, the camp shall have sufficient number of counselors to ensure the safety. The ratio will be provided in the following slides as well. Safety procedures, including the storage and handling of hazardous materials, have to be described. Procedures should describe how the camp stores and handles any hazardous materials at the campsite, such as gas and liquid flammables, explosive medications, insecticides, and any other hazardous materials. And it also should mention what staff is trained to handle those materials and what kind of PPEs are being used to deal with that. The identification of potential environmental hazards have to be also identified on the procedures and the plan developed on how to cope with those hazards. The equipment repair and maintenance, camp-specific equipment have to be listed, and procedures for equipment repair and maintenance have to be also provided. And the equipment access and control should describe how often the equipment is being inspected for safety and who's responsible for the inspections. Here's the table with summarized information and staff minimum qualifications and required background checks and trainings. So all camp staff 18 years of age and older are required of background checks and mandated reported trainings. All counselors, health supervisors, and the directors must provide, maintain, and satisfactory evidence that are trained in the first aid and CPR that was mentioned before, as well as be trained on the camp health and emergency plans. Regarding the camper staff interaction guidelines, all staff and counselors should receive a training on minimizing the potential of one-on-one counselor-camper interaction when they're not visible to other counselors or campers. So going forward on the background checks, all individuals over the age of 18 who work or volunteer at the children's camp, the director of children's camp must provide a written statement verifying the director's review of the following: the satisfactory criminal history record check from the Department of Justice, satisfactory record check for national sex offenders, public registry, and the satisfactory voluntary disclosure statement. And also, all the staff have to follow mandated reporter requirements. The camp director and any staff that serves as an acting director must complete the training on the requirements and protections of California Child Abuse and Neglect Reporting Act, CARNA. The training must be repeated every 2 years. And all individuals over the age of 18 who work or volunteer at the children's camp must sign the statement provided and retained by the camp operator, informing them that they are mandated reporters and advising them of their reporting responsibilities and of their confidentiality right. The training of the California Child Abuse and Neglect Reporting Act is also highly recommended for those individuals. And the last point, the criminal history record check and voluntary disclosure have to be provided for the camp director as well. So the counselor to camper ratio differs depending on the type of activity that the campers are doing. For general activities, it's 1 to 12 campers for 3 to 5 year old campers, and 1 to 15 if the campers are between 16 to 17 years old. For passive activities, it's the same. For 3 to 5 years old, it's 1 to 12, and for 6 to 17 years old, it's 1 to 25. For the specialized recreational activities, the counselor must be 18 years or older, and the ratio is 1 to 6 for 3 to 5 years old, and 1 to 8 to 6 to 17 years old. Also, the following plans have to be developed and submitted to the department and maintained on file at the campsite. We will break down each plan in the following slides, and all the required plan templates are available on our website. The camps may use their own templates, but must include all the required elements on the templates. So the camp has to provide camper health plan, emergency plan, specialized recreational activities plan, transportation plan, aquatic plan, insect and rodent plan. Going forward with the camper health plans, the camper health plan shall be developed in consultation with and reviewed annually by a licensed physician. And as you can see, there is a screenshot of the first page of the plan, and the full version of the template is available on our website for your review and use. So on the first page, you can see the physician name, the contact information, license number, and date reviewed have to be provided. And also the plan have to include the following procedures for the camper health screening. We'll go into details on the health screening in the coming slides. And arrangements for on-call healthcare consultation services. So the name, contact information, and credentials of on-call health consultants have to be included. Arrangements for emergency healthcare services and emergency transportation to healthcare facility. The name and address of the healthcare facility that's being used have to be noted. How the transportation is going to be provided by camp or 911 have to be mentioned. First aid and healthcare supplies. We have to mention what necessary healthcare equipment and supplies are needed, what kind of PPE is needed, personal protective equipment is needed at the camp, and how they're obtained. The storage and administration of a camper prescription and non-prescription drugs and medications, how the prescribed and over-the-counter medications are stored and administered at the camp, including the temperature-sensitive medication. Continuing on the health plan, the medical procedures for the camper trip away from camp location or the site have to be described. We have to describe what kind of medical procedures that needs to be administered away from the camp location, and the transportation details have to be also provided. Procedures for daily observation for each camper's health. The procedures for have to be described, including signs and symptoms of potential infectious disease and other illnesses that our campers are screened for. What happens if one or more symptoms are observed? Are they sent home, or you're contacting the parent and guardian? That all needs to be described. Procedures for a camper medical privacy. The place of medical examination or isolation shall ensure privacy and not be located near directly adjacent of food storage, preparation, or service areas. Oh, I think I left out the procedures for prompt response and notification of the camper's designated emergency contact. So you have to describe in what cases, in case emergencies, the emergency contacts are notified, who notifies them, and if the responsible person who notifies the emergency contact has access to all emergency contact information. And also procedures for preventing disease transmission and universal precautions. In this case, implementing standard precautions, hygiene, facility cleaning, food safety, etc., have to be implemented. And at the end, the camp staff and counselors should receive training on the camper health plan. The health supervision on the campsite must be done as follows. The qualified person is a director or designee that can serve as a health supervisor, must be present at the camp location when the campers are present, have to ensure compliance with the health plan, meet the first aid and CPR training requirements, and have to be trained to implement the health plan. Any camps that are located in rural or wilderness areas or provide overnight stays have to have a full adult health supervisor, which will be a physician, registered nurse, or a licensed vocational nurse. Going over camper health screening, so camper and staff shall furnish health status and a history signed by a camper or a parent guardian. If the counselors are 16, their parents have to also sign the health history statement. Health documents shall be kept on site for duration of the stay and should include the following: the contact information, description of health conditions requiring medication, treatment, special restrictions, immunization records, and date of last tetanus shot. With immunization records, if there are immunization records for the kids or adults, then it needs to be provided for the record. If they haven't been immunized, then we can skip this part. And record of any allergies have to be provided as well. And also the signed statement by a parent or guardian to seek emergency medical treatment for under 18 years old have to be provided. Medical logbook for each accident, injury, or illnesses involving a camper or staff member have to be maintained on site and should contain the name of the person that got the treatment, dosage and intervals of the medication dispensed, first aid or medical treatment rendered, name of the person that administered first aid or medical treatment, date and time of the treatment, and the date that parent or guardian had been notified of the accident, illness, or injury. Going forward to emergency plan. So the site-specific emergency plan has to be approved by the director, and the plan should address the following: natural disasters, lost campers, fires, transportation emergencies, severe illnesses and injuries, unauthorized persons in the camp location, aquatic emergencies as appropriate for the site, and other emergency situations as appropriate. I mean, you can see also the template will be available, and all the details can be found on the template, what needs to be addressed as well. And also, emergency plan shall include the procedures and describe the evacuation plan for the campsite and the locations used that when you evacuate, which locations are you going to use to move, and who will be in charge of transporting the campers, as well as the transportation method, and who will control the vehicular traffic at the camp in case of emergencies, and how the communication will be provided between the persons in charge at the camp and medical facilities and the fire station. And the staff director, the camp director and the counselors shall be all trained in implementing the emergency plan and procedures. And this will be also verified during the inspection by our inspectors. Moving forward to specialized recreational activities plan, the site-specific specialized recreational activities plan also have to be developed and must include all of the following, and also be available on site, and should include supervisor qualifications and training. Supervisor for the activity should have sufficient certification or documented training and experience in the typical activity. And the staff skill requirements should be identified, and how the skills are verified have to be described in the plan. Participant eligibility requirements, if the camp has camper eligibility requirements on the specific activity, the requirements have to be mentioned on the plan, and how the campers are tested on the eligibility. Equipment needed, maintenance and repair. What kind of equipment is needed? The list need to be provided. How equipment is inspected for safety, and how often, and who's in charge of the equipment check. Activity design, area design and safety procedures. So you should describe the general safety precautions needed for activities. Does the accredited organization inspect or certify the specialized activity? And if yes, provide the latest assessment report from the organization that the specific specialized activity has been inspected and deemed safe to be used. And you should also identify any protective equipment that's being used for a specific specialized recreational activity. Include the access and control. Also, you have to describe where's the equipment stored and how is the access controlled if the areas are not in use or supervised for camper safety. I'll have a couple of pictures that was taken at the Camp Tumbleweed, and I want to thank Andy that he let us use these pictures for our presentation. We wanted to just show a couple of examples how you can safely ensure the specialized activity not to be used during how you can control it when it's not in use. So again, you can see that the lower grips are removed here for the climbing wall, that the kids cannot climb when the climbing wall is unattended or are not in use. And also the steps for the rope course can be removed when not in use to control the access. Again, here it's a little up closer. They can see the lower grips are removed to the height of the one of our chiefs that volunteered to kind of pose and show how it's done. And other methods can be used depending on what kind of specialized recreational activities you have, or either the equipment can be dismantled or somehow eliminated, like so the kids cannot access it when it's not in use. Some firearms storage precautions. When not in use, all firearms, if if they're used at the campsite, have to be stored in a locked cabinets or closets in the locked room and inaccessible for the area for redundant safety. All ammunition have to be stored excuse me, in either a third location or a container requiring a separate key or access system. Also, the shooting range safeties will include the bullet trap and specific safety zones behind the targets, clearly delineated rear and side safety buffers, and clearly defined firing line, and plan to recover or contain spent lead bullets and clear safety signals when all these bullets are being collected. Also, you have to ensure the workers are protected for any lead exposure when they are collecting those lead bullets. Some archery safety, again, the buffer zone behind the targets have to be delineated. The site safety zones have to be known to the entire camp population and clearly defined shooting lane. And safety signals and range commands have to be implemented for the campers to know that the activity is in use, so no one can come to those safety zones. Farm or domestic animals. If you have any farm domestic animals at your camp, all the animals have to be vaccinated and the records have to be kept on site. The pets or animals are not permitted at the swimming pool or food service area unless it is a service animal. And you can see hand washing stations should be provided in case after the kids' interaction with the pets, so they can safely wash their hands and proceed. Going forward to the transportation plan, shall address the following transportation, and the transportation actually issues are coming up in some different plans that we've already went through. Like the emergency plan has the transportation aspect of it. The health plan had the transportation aspect for it. So, and this one will also cover the transportation campers staff for offsite activities, like if you're providing any transportation for field trips. Some camps will provide the transportation to the camp and from the camp. So all that needs to be addressed in the transportation plan, like the departure time, arrival time, the routes that the transportation routes that is going to be used in regular days or in case of emergencies. And also the transportation plan should include the driver's information and the record check, who will be utilizing the transportation mean, the vehicle type and capacity, the vehicle safety check logbook, and how often the vehicles are being checked, what is being checked, if all the safety precautions are up to date, the travel procedures and accident procedures, etc. All that has to be addressed on the transportation plan. As it was mentioned earlier in our earlier slide, swimming pool facilities have to be separately permitted with our department. If most of the camps that have swimming pool facilities with them should already have been permitted by our plan check program. If for some reason you don't have a separate permit for our for your pool, then you would need to obtain a permit with our recreational waters plan check. And going forward to our aquatic plan, so the plan must be developed and maintained by the director and submitted to the department prior to use. And the plan should address what kind of natural bodies of water are being used, identify the aquatic activities such as boating, sailing, swimming, scuba diving, etc. should also address campers' eligibility if the campers are tested according to their aquatic abilities before they're engaged in the activity, and if they're tested, are they separated into groups, and how each group is treated for several activities, and what kind of activities are they participating if they are divided into different skill groups of their abilities. And the department may specify special conditions to protect health and safety, such as microbiological sampling of water. If, for example, natural body of water, for example, lake is being used at the camp, and the test results have to be provided to the department's review and maintained on the site. So if the site has any aquatic activities, then should be equipped with at least one lifeboat or equivalent water safety device, and the safety device or the lifeboat have to be used for no other purposes than for saving lives or other emergencies, and should be kept in good repair and readily accessible to the areas of potential use, and must comply with the California Harbors and Navigation Code. Before the use of natural bodies of water, the hazards must be identified, such as depth measurements, location of eddies, presence of dangerous currents, sunken logs, rocks, and obstructions. And legible signs must be placed in the plain letter and be visible from all swimming areas, and have to indicate whether the depth locations of pools and eddies, presence of any currents. So the designated aquatic supervisor, at least 18 years old, have to be present on site all the time, and have to possess an American Red Cross lifeguard certificate, YMCA swim life-saving certificate or equivalent. One lifeguard per 25 campers have to be present at the waterfront activities, and one counselor for every 6 campers. For 3 to 5 year old campers, and one counselor for every 8 campers, 6 to 17 years old, should be poolside, beachfront, or in the water to provide direct visual surveillance of the campers at all times. Going forward to our insect and rodent plan, so each camp should identify camp-specific possible insect activities and measures to cope with those activities. Either it will be flies, mosquitoes, cockroaches, rodents, bedbugs. It should be inspected, identified, and taken care of, and also it has to be addressed in your insect and rodent plans. You should provide the service provider the pest control information, and how often is the services provided, and what kind of pesticides, traps are used throughout the camp. And here I think we will break for some questions regarding the previous slide, and then we can continue further.
Okay, we have a question in the chat. Carrie asks, what defines food service for camps, and whether a food service permit is needed?
I'm going to go over the slides right after this Q&A.
Okay, the next question is from Natasha. She asks, are there any restrictions or guidelines for who is allowed to drive transportation to offsite activities? Example, must be a certain age or have license for a certain number of years.
So the transportation plan has all the descriptions in there. If you pull out the template, we want the driver to be 21 years of age and hold a valid vehicle operator's license for the type of vehicle that they're driving, and have a clear DMV record that has to be checked for the participants. And of course, you have to have some kind of experience if they're driving children around. You would kind of need to do some research on that. And all that information is available on our template. When you pull the template, we have it all itemized.
Okay, just gonna allow a couple more seconds to see if anyone has any more questions to type out. Okay, Tadovic, I guess ready to continue with the presentation.
Okay, going forward to the question about the food services. So yes, if the camp is providing on-site food preparation, if you're cooking the food or reheating the food, or serving the food on site, you would need to have a separate permit, and the permit needs to be obtained from our plan check program. I have our plan check program website here that you can go through the link and see what kind of documentation you need to provide to them. I think I've noticed like some of the camps that are located in parks and recreation sites, some of them might already have a public health permit issued to them. So in that case, you just need to mention it in your plan that you already have a valid public health permit. And a separate inspection will be conducted for the food services. If you have a food service that you provide, on-site food service, the camp also should have a contingency plan in place developed in case of food facility closures. And the food facility can be closed for no water, vermin infestation, any sewage accidents, backflow, or anything happened that can cause public health permit suspension. The facility should have a separate plan how they are going to provide food to the campers in case of a closure. That's when you have a public health permit. The camps that catering the food from outside, they don't do any preparation. They just get the food from the outside vendor. They don't need to have a separate permit. It's the vendor's responsibility, and the vendor should have the standard operating procedures, how they bring the food to the site and serve the food to the campers, and of course all the utensils or single service items that are provided by the vendor have to be taken care of the caterer who's bringing the food. And also you won't need a separate food service food permit if you have only prepackaged non-potentially hazardous foods at the camp, and if the storage area is less than 25 square feet. In this case, you wouldn't need a separate permit, but however, the food has to be stored in a safely manner away from any possible contamination. I hope I answered all the questions regarding the food service. If there are any further questions, you can type it in the chat. Structural requirements. Like Jim mentioned in the earlier slides, or all the structures they use at the camps have already to be approved by building and safety and the fire department. When we do our inspections, we are going to make sure that the building structures, tents that are being used are in good repair and kept in a clean and sanitary manner. All the appliances, equipment, mechanical, electrical, and ventilation shall be maintained in good working order. If it's an overnight camp, if you're providing any overnight stays, and if you are providing the mattresses, covers, blankets, shades, pillows, or sleeping bags, they have to be clean, in good conditions, and shall be laundered and sanitized prior to issuance to the camper. And all the mattresses that's being used shall be covered with the waterproof material or washable covers to be easily cleaned and sanitized. And the sleeping accommodations, again, if you are providing any kind of sleeping, like overnight sleeping, the room or place for sleeping should have sufficient lighting, windows, ventilations, or drainage. And room occupation by 2 persons should not exceed 630 cubic feet of an airspace, an additional 500 cubic feet airspace for any additional persons. The space between the sleeping bags and the beds have to be 18 inches, or there should be a physical barrier provided. And the head-to-head sleeping is prohibited, and each camper shall have an individual bed or sleeping bag they shouldn't share. The water supply. So the drinking water shall be provided and be centrally located in the children's camp. So the dependable water supply of potable water adequate to provide 50 gallons of water per person per day shall be available. In case the pit or chemical toilets are used, the 50 gallons may reduce to 30 gallons per person per day. If the water supply is not provided by the municipal water company, i.e. public water systems or wells, then the permits and approvals have to be obtained from our department drinking water program, and shall comply with the Drinking Water Act, with California Safe Drinking Water Act. Hand washing requirements. The hand washing facilities shall be provided adjacent to any flush toilets within the camp, and should be equipped with the single service soap dispensers and single-use paper towels, and be kept in clean and in good repair. The shower requirements: when the campers are present for 3 or more consecutive days at night, the camp shall provide showers, and the shower heads have to be provided with the hot and cold running water for 1 shower head for 15 children of each gender. Open air showers may be provided adjacent to swimming areas if the camp operators wants to provide them. The toilets, 1 toilet for 15 children of each gender has to be provided. The chemical toilets may only be used in remote areas where a plumbing system is unavailable. And the children's sleeping accommodations shall not be located over 200 feet from a toilet. And also the toilet facilities shall be maintained in a clean and sanitary conditions and in good repair as well. Garbage and refuse. All garbage and refuse shall be disposed in and stored in a fly-tight, leak-proof, non-absorbent containers. Shall not be kept for more than 7 days. So the trash pickup have to be arranged on a timely manner. And the containers and refuse areas shall be kept in sanitary conditions, not to promote any fly breeding at the campsite or rodent harborage at the campsite. The drainage. Any children's camp that use trails shall be properly drained to eliminate standing water. That will promote the camp safety, and also will help coping with mosquito breeding or rodent harborage as well. The public notifications. The department will post on its website all the registered and the camps that have obtained a public health permit within 15 days of the issuance of registration or public health permit. And routine and complaint investigation reports will be posted on our website within 7 days of the inspection, and you can see the link. You can go to the link and get access to our reports that's been issued to any of the camp. And you can search by the address, by the camp name. It gives a lot of options for the search. Public health permit suspension. Any children camps registration or public health permit may be suspended or revoked by the department for violations that poses an imminent danger to the public health or safety. And if that's that can cause or is reasonably suspected of causing infection, illness, disease transmission, hazardous conditions. Some of the reasons that the permit can be suspended can be no water at the camp if there is no water available at all at the campsite, no working toilets if there are no working toilets available that the campers can use. I mean, one toilet, of course, won't lead to the permit suspension, but if all the toilets are not working, it might lead to the permit suspension. Unless the violations that I am listing for the permit suspension reasons are not corrected by the end of inspection. If the violations have been remediated by the end of inspection, then of course we're not going to suspend the permit. Now, no working toilet, like I said, sewage spill, liquid waste discharge at the campsite, and also no public health permit available for the site. And in this case, we're going to work with the camp operators to work with them to issue the permit as much as possible. And again, if by the end of inspection all the violations corrected, then we won't proceed with the permit suspension. So again, if the permit suspended, the compliance review will be held to discuss the violations resulted to closures. A written decision to maintain, suspended, or revoke the permit will be issued within 15 days after compliance review. Suspended registration or permit may be reinstated if the violations are corrected. If revoked, if the permit has been revoked in a result of the closure, a new permit may be issued if all the conditions set in the compliance review are met. And towards the end, this is the sample of our inspection report that our inspectors are going to use to when they're doing the inspections. I just want to go slightly over the report to show you, like on the top that you can see the information for the program and the contacts for it, and you can see the name of the camp, owner permitting name, and the camp address, and the program elements and all that stuff. And if you get the report and you see that some of the information on this top portion is not correct, please reach out to the inspector and let them know that the information is not correct, that we need to correct it. So again, you will have the date of the inspection, the compliance date. If there is a compliance date, you will see what is the reinspection date will be here. And then you will see the service, what kind of service has been provided. Was it a routine inspection? Was it a reinspection, complaint investigation? And what was the result on action for the inspection? It's either a correction or follow-up required or no follow-up required. And going forward, you can see that the report is kind of broke down in the violation groups. The first group is the requirements for camps, all the documentation, all the requirements like the directors requirements have to be checked, written operating procedures and plans that our staff is going to check. And the status of the violations are going to be marked as either in compliance, out of compliance, corrected on site, or not observed or non-applicable. There might be some violations here that won't be applicable to all the camps together. And then after the requirements for camps are passed, the staff training, the counselor ratio, that the staff is going to verify all this during the inspection that you have it on site. With the health plan, where the staff will verify if the health supervision or designee is present at the camp, or health records are gathered and maintained properly. The medication, if it's kept in a appropriate way that was mentioned in the health plan. The isolation area, if it's in accordance with the code and provided. The first aid and healthcare supplies that are provided and in place, that you have it available on site. This is like the physical facilities, like when the inspectors are on site, they're going to check for this. Camps and trails, the camp safety, drainage, insect, rodents. So on the top, we have an insect and rodent plan. You might have everything nicely addressed in the plan, but in an actual on ground, you might not have it addressed. Like if we see any insect activity at the site, we're gonna mark it here out of compliance. And the camp programs, the specialized activities, trips and transportation, and firearms, any violations that we see in implementation of the specialized activities plan or the transportation, trips and travel, it will address in this area on the implementation side. The same comes here with the lake, stream, and river in aquatic plan. If the aquatic supervisor is present and have all the qualifications, the lifeguards are by the requirements, and the lifeboats are present. The safety hazards have been identified and taken care of. The sites are present, and also the signs are present. Down we go with the building structures, and if all the requirements are met with the, if the constructions are met with the approvals, if the safety detectors, fire alarms are in place and in working orders, if the structure, tents and cabins are in a good repair and sanitary conditions, electrical equipment, appliances, if they are in good standing order, and if all the exits are provided by a building code. The sleeping accommodations, we already went over it, the water supply, hygiene facilities, and the waste. And the last section is our compliance and enforcement, which is addressing notice of intent. If the notice of intent have been provided in a proper manner, which is the 30 days before the operation, unless you provided it with your permit applications. If your permit's available, if you have a valid public health permit, the inspectors will check the availability on site. The public pools, if you have a public pool, then we'll check for the valid permit. The food service, again, if you have a food service, we'll check if it has a separate permit, or if the food is catered in, we'll see if the food is the caterer is an approved facility. And I would recommend to have the copy of their public health permit available on site for our inspectors review when they're doing the inspection for the catering services. Again, public water system, if the permit is required, a separate one. If the permit suspension is done, then we will mark here. If we refer to other agencies, all will be marked here if those actions are taken, or if the compliance review issued or a citation issued. So this is our review of inspection report. So going forward, this is our website that you can find all the forms and informations. Our phone number here at the Camps and Schools program, you can see 626-813-3428. You can call us and we'll answer all your questions if we won't have enough time to address it by the end of the presentation. You can also email us your questions, and permit applications can also be emailed to our Camps and Schools email address. And for the complaints, you can reach out either to the program or our hotline to place any complaints for the camps. And going forward, any questions?
Okay, so our next question, it actually looks like it was answered by Faradine in the comments, but I want to make sure everyone has the ability to hear and see it. By Kara, does serving snacks that we don't prepare on site require a permit? The answer was no, it doesn't need a permit, but full vendor's info shall be available. Okay. Our next questions are similar, so I'm going to go ahead and combine them by Carrie and Cara. What about camps that do not provide food services to campers but offer cooking as an occasional activity? Tadovic?
That would be addressed as a specialized activity, I guess. I would say specialized activity. Jim, what do you think?
Yeah, and maybe we can follow up with a more clear answer. But yeah, I don't, at this point, I don't think it's going to require a permit since it's part of the school, the camp activity, similar to our schools that have like a home economics class where they learn to cook. So we'll follow up on that with a more detailed response, but at this point, I don't believe that's going to require a public health permit. And to follow up on the previous question about if they're receiving food from another source to provide to the campers, you do need to ensure that that source is a permitted food facility that's an approved source for the food.
Okay,
Yes,
thank
and
you
I
both.
would recommend, I'm sorry, and I would recommend to have the copy of their public health permit available on site for the inspector's review.
Okay, thank you both. We'll just pause another moment to let any other questions filter in. No other questions? Okay. Well, it seems like there's nothing further. Thank you all for your participation and questions. Thank you also to James, Tadovic, and Faradine for your presentation. The recording of this meeting will be posted on our website within a couple of weeks. Again, feel free to contact the Camps and Schools program at 626-813-3428 for questions. This webinar has ended. Have a great remainder of your day.
Thank you, everyone.
Thank you. Bye.
Thank you all.
Yeah, I'll hit stop.